As nursing homes face more scrutiny, their weaknesses are being exposed by this virus. Tonight, I-Team Chief Investigator Charlie Specht is looking into the horror stories at a local home and making sure people in power are doing what's right.
Kyle Brakenbury's mother has COVID-19, and he's almost certain she got it in a nursing home. He recently took to Facebook to write, "This is not just a number. This is our mom, wife, grandma. Our mom is now COVID positive, a direct result of the incompetence and mismanagement of the Villages in Albion." The Villages of Orleans and Albion is one of the lowest rated nursing homes in Western New York, with just 1 out of 5 stars and recent fines by the federal government.
I'm not talking about shutting the place down here, but I just feel that the powers that be need to be held accountable. And I mean, we're talking about people's deaths here.
Orleans County health officials say the nursing home has 49 cases of COVID-19, and the state health department reports that 12 people there have died of the virus. Brakenbury's mother first came to the Villages for rehab after other health issues. Before discharge, she tested negative for the virus, but Brakenbury says the staff failed to isolate her for the next 3 days and put her back in her room with her roommate, who later tested positive.
And that's what our major complaint is why was she not isolated after the swab, since she would have been negative then.
Right.
So she got positive waiting for the test results.
Assemblyman Steve Hawley of Batavia is asking the state health commissioner for an immediate and full-scale investigation of the nursing home, where he says staffing has been depleted and demoralized. His letter also contains allegations that, quote, a nurse in the dementia unit swabbed 6 patients and was told by the director of nursing to throw out said swabs and not be sent for testing.
Have to do separate cohorts for COVID positive versus COVID negative, not only for the residents, but also for the staff.
State officials say nurses treating COVID and non-COVID patients must be separated. But a nurse told us last week that she quit the Villages because management pushed her to cross between departments.
We have provided hundreds of thousands, if not millions, of PPE to nursing homes all across the state, including downstate. Hundreds of thousands of gloves, hundreds of thousands of goggles, face masks, gowns.
But both Holly and the nurse report that protective gear, quote, is locked in the director of nursing's office and only released when a DOH inspection is to occur. A spokesman for the state health department said the agency launched an unannounced COVID-19 inspection on April 29th and found the facility, quote, in compliance with infection control practices and CDC-supported guidelines issued by New York State. Nursing home administrators did not respond to our request for comment, but the families tell us they've already been in contact with the state attorney general's office. The AG's office said it is investigating a number of nursing homes, but declined to comment on this specific case. For the I-Team, Charlie Specht, 7 Eyewitness News.